Cancers are a condition that no one wants near their eye, but it does happen. And squamous cell carcinoma is one of those conditions, one of those cancers that are very, very sneaky, and they do happen in adults' eyes, commonly adults. And so today we will be discussing this, and you can find out how will you be able to know that this is happening, because sometimes it's happening and you just don't know. So keep watching to find out. This is the Dr. Tebz Show, and we're putting your health back into your hands. And to discuss this very intriguing medical condition, I am being joined by Dr. Hamzah Mustak. He's a qualified ophthalmologist who's heading up the Ocular Plastics and Ocular Oncology unit at Groote Hospital in Cape Town, as well as having his own private practice at the Atlantic Eye Center. And so it's a great privilege to have this very professional, talented, and well-experienced ocular plastic surgeon with me today. So thank you for joining me today, Hamzah.
Pleasure, thanks for having me.
Yeah, so Hamzah, can you just tell us, Dr. Mustak, can you tell us the anatomy of the eye that is affected by squamous cell carcinoma?
Okay, so squamous cell carcinoma is sort of implied in the name, is a cancer of the skin, so skin layers. So you get two types of skin layers in your body. So one's the outer skin that we see, which consists of squamous epithelium, and then you get what we call mucosal membrane. So these are the linings inside your mouth, inside the nose. So the hidden structures that you don't see, and the inner lining of the eye, as well as the lining of the eyeball itself. So squamous cell carcinoma, when it comes to the eye, can affect the skin of the eyelid, or it can affect the conjunctiva, which is that surface layer of the eye.
Okay, all right. So having described that, so how does a person get this, and is it preventable, having squamous cell carcinoma?
So if we so we're talking about the two entities. So one would be the eyelid or eyelid skin squamous carcinomas, and so the question is, can it be prevented?
Yes.
So in most cases of it, the answer would be yes, because it's related to sun-related damage, as are a lot of skin cancers. So wearing sun protection for the eyes, obviously it's a bit tricky to put sunscreen on your
actual eyeball or eyelids. Yes. Yeah.
So if you're out in the sun, things like wearing a hat or UV sun protection in the form of UV glasses or sunglasses to help protect the eye, and just minimizing your exposure to that. Then certain conditions we see, so for example, we obviously here in Africa we don't get a lot of it, but I suppose in the desert countries or where there's a lot of snow, we often don't realize the reflection of the light of the snow or the sand can reflect back in our eyes and increase the exposure to UV radiation. And then in some patients, unfortunately, but this is very rare, they carry a condition which predisposes them to developing skin cancers. But just to note there that it's a very rare condition that we would see.
Yeah. And then how about the squamous cell carcinoma of the conjunctiva?
Okay. So squamous cell carcinoma of the conjunctiva we see fairly commonly actually in our setting. So there are, broadly speaking, two groups of people who get it. So it's got what we call a bimodal incidence or prevalence pattern. So more commonly in the elder age group, so 65 above, and this is related to sort of a lifelong exposure to the sun and UV and irritants like dust and environmental irritants. And so that's the one group. The other group is those who have a weakened immune system or immunocompromised. So here in Africa, especially sub-Saharan Africa, we see it in our HIV sort of patients with HIV or HIV prevalent population group.
Yeah, no, very true, very true. So how would a patient know that they've got squamous cell carcinoma? What would they see on their skin, on their eyelids as you've described, or on the actual eye? What would it look like?
So on the eyelid skin, it would present differently than on the conjunctiva, the eye surface. So often on the eyelid skin, it can seem fairly innocuous, and it can initially be a slow process. And so you notice a red raised area on your eyelid. There may be focal loss of eyelashes in that area, or there may be a small nodule or bump that forms on the eyelid. And if it's one that has an ulcer, so an ulcerating surface, or like a weeping wound on the surface that doesn't seem to get better, then that should raise the sort of alarm that this might be something else going on. On the conjunctiva, on the surface of the eye, then it presents as a growth. So the wall of the eye actually forms a barrier, a sort of natural protective barrier. And so if it's growing on the surface, it will tend to grow outward, like a bump. And so how you notice it is initially just a small growth, usually on the inner side of the eye. And it's something that grows progressively. And the other features that you would want to look for is if there's a white discoloration on that growth, something we call leukoplakia, or if it's got a nodular bumpy appearance, then, and with progressive growth, then that should sort of prompt you to go and seek attention.
Yeah, I think I like what you said, that it's progressive, because we all have little bumps in the center of our eyes, in the middle of our eyes, and so you could be like, oh my gosh, is this, but it's not, as you say. Most of them are just little bumps.
So the other thing patients might complain about is that if it's raised and it's growing, it almost feels like there's grit or sand in the eye. And so they have this constant irritative feeling associated with that growth.
I actually had a patient who had this growth, and he just said, "Doctor, I thought this was going to go away. I mean, this thing had grown so big, it had covered his whole eye."
Exactly.
So it does not go away. So having said that, how do we treat, both the skin, squamous cell carcinoma, and conjunctiva? How do we treat both of them? Okay.
So when it comes to that, again, I like to work with other team members, or multidisciplinary approach. So often including the oncologists and the allied professions that work alongside us to help manage these conditions. But in most cases, so if you look at the skin type of squamous carcinoma, the standard of treatment for those is removal. So surgical excision, and we excise it with what we call a margin. So that's a bit of the normal tissue outside the abnormal tissue that we can see, because we want to make sure that we've got a complete clearance of the tumor. And in more severe cases, we might combine this with chemotherapies or radiation treatment to the skin area. Then when it comes to the conjunctival surface, again, depending on the size of it, but the standard is to excise to a removal of the tumor with a margin again, in this case. And then following that, once the surface is healed, then depending on what the pathology report comes back as, we will give a course of topical chemotherapy. So this is eye drop chemotherapy in the form of eye drops that you would use to prevent recurrence.
Yeah. And is there ever a situation where you have to remove the eye? Because I think that's why people delay coming. They keep thinking the doctor's just going to remove the eye. Is there ever such?
So to answer that question, simply yes, there is, but I'm going to qualify that now. So the other issue I have that I face, that concerned patients have, is that when we raise the concern that we think there's a cancer growing on the eye, the question is always, are you going to remove the eye?
Yes.
So when we remove those smaller tumors, then patients always want to know, do you take my eye out while you're doing it? And the answer is no, we don't. We remove that layer on the surface of the eye which is involved. But if patients present late with delayed presentation, so that's where the tumor has gone grown past the confines of the natural barriers. So either gone into the wall of the eye where it invades, or down, it tracks along the muscles that attach onto the eye and tracks backwards behind the eye, because then it's got access to the blood vessels and the nerves. And so in those cases, unfortunately, we have to employ more drastic measures, which are destructive surgery, like removal of the eye.
So the lesson here is that come earlier rather than later.
Absolutely.
Because then there's something that can be done that is not as drastic. So so now you've treated it and the tumor's gone in both conditions. Can it come back, or is it like, okay, you're done, bye, great?
So when it comes to cancers, we obviously we have to monitor the condition. Thankfully, when they present early enough, then it's often confined to that area, which means that there isn't spread to the rest of the body. And particularly these skin cancers have a lower predilection to spreading than other cancers in your body. But squamous cell carcinoma can be quite aggressive. But they tend to sort of invade locally, if you like. And so obviously part of that would be the staging, depending on how advanced the presentation is. So once it's treated, then our treatment is aimed at cure. So this is the kind of cancer that whatever treatment we're instituting would be aimed at a curative effect. That being said, obviously we have to monitor for risks of recurrence. So even though we've done a good surgery with which the pathologist shown clear margins, there's a possibility that 1 or 2 cells might lie outside of that, and so we have to monitor in the early period for recurrence. But the longer the time passes where we don't find recurrence, the less likelihood that you will get a recurrence. Of course, that doesn't stop you from getting a new tumor somewhere else.
Exactly. So in your experience, I want to dabble a bit more into your experience, because I mean you've treated many patients like this. You know, what are some of the reasons why people do present late? Because I think we battle with this, you know, why do they present late when we can do something? And secondly, how do you encourage the patients when you're treating them to actually stick to these, as you're saying, you need to monitor, you need to come back? Because most patients literally, you know, they default follow up. So I want to address this, you know, because there's someone watching who maybe has not come back.
No, so I mean, it's a difficult problem we face here in a developing sort of setup. Especially with the type of healthcare sector that we have. And so I think part of the problem is oftentimes, as we've mentioned before, that we'll talk to patients and say, why didn't they come earlier? And they will often report that they went to the clinic or they, you know, to see their local hospital and were given a cream or an eye drop to take home. And so I think part of the problem also is education about eye-related conditions, which I think is something that needs to be addressed in terms of training of healthcare staff. And so I think that's one big component that it's not picked up or misdiagnosed at the primary level. And the other is patients who think that you know, it might get better. It might get better. And part of that, I think, is also a fear of what would happen if they do go to the hospital. And so unfortunately, we do see advanced cases that often require destructive surgery, but with the aim of preserving life. No, the only reason why I ask is because this is the one reason why I actually started the show, because I used to see so many patients presenting with, as you're saying, the squamous cell carcinoma on the conjunctiva. And they would, and it would break my heart knowing that had you just come a little bit earlier, 3 months ago, we'd be discussing a very different topic, so a different situation. So yeah, that's why I really posed it to you to say, you know, why. So no, thank you for answering that question. So no, thank you very much, Dr. Mustak, for this. But can you tell me, what are your closing thoughts in, you know, particularly with squamous cell carcinoma of the skin and the conjunctiva? Okay, so I mean, if we have to summarize the discussion, so if you're someone who's had, you know, a few years prolonged exposure to UV radiation, the sun, so we're talking about the elderly age group who presenting with the clinical feature I said, so, you know, a lesion on the eyelid that's not improving or getting better, or growth on the surface of the eye, you know, I'd encourage you to seek medical attention earlier rather than wait to see if it resolves. And then the other message is that if we can pick these up earlier and treat them early, then the cure rates and success rates of treatment are higher, and we can avoid destructive surgery.
That's a good note to end on. thank you very much for joining me today.
Pleasure. Thanks for having me.
And thank you, viewers, so much for joining us today in this episode. We were discussing squamous cell carcinoma, that little sneaky cancer that can affect your eye. So if you'd like to have more information or know more information about this, or you'd like to contact Dr. Mustak, we'll leave the details in the description box below. And remember to share, like, and subscribe, and push the notification button so you know when we post our next episode. So until next time, take care of yourself, take care of each other, and remember, your health is in your hands. God bless.